Howdy, everyone. Matt here. I got a question for you. How do you think we, as healthcare providers, feel about health insurance companies? Let's talk about that. But first and foremost, let me introduce myself. My name is Matt the PT, coming at you with another video on another topic in the physical therapy world. And that is about how we as providers feel about health insurance companies. I'm going to be very candid about this and share some of the experiences that I have dealt with. Hopefully share some of the ones I've had people share with me and to talk about that, because this has been a big topic here lately. People coming in talking about their experience of saying, hey, I paid all this money for my insurance premiums. I pay all this money out. But when I needed it, they said, nope, we're not going to cover that. Nope, we're not going to do that. And this person ended up getting very sick. Maybe they were hospitalized or even passed away. And it's coming out with providers. If I've seen physicians talk about it, say, hey, I ordered this for a patient because my medical expertise and knowledge said this is what they need, but this insurance company comes in and goes, nope, they don't need that. We're going to make the decision that we feel is best for that patient. And I'll be honest, same thing happens in rehab. We often get these insurance companies that will come in between us and the patient and make a decision about what the patient needs instead of what the provider and the patient agree upon that they may need, because that is an important part of it. That is something that we do, that when you come in, we want to have that conversation with our patient to understand, okay, this is what you have going on, and based upon our experience and our knowledge, okay, this is about how long it's going to take. This is what we need to do, and we want to talk to you about that. And hopefully we find this middle ground and say, yes, I believe what you tell me to do, I'm going to do that, and we could reach that over there. Because ultimately, as a therapist and really in healthcare, the biggest thing that we want to do is help people. We are on the side of our patients. If you talk to any provider, they'll tell you about that. They got into this to help people because so many of them were either a patient at one point or they saw a family member who was a patient at one point, and they saw what they went through. They saw what that family member went through. They experienced them themselves. They went from this very low point in their life and they did rehab or they did this and they came out on the other side. And we tell ourselves, that was an amazing experience. It was hard. It was tough. But look at where I ended up and look at what happened beyond that. I reached this point. I never thought I could be here. I never thought I could do this. I want to do this with other people. I want other people to experience this. And I want to get people as better as quickly as they can to live as maximal a life as they can. That's ultimately what so many of us want. But I'll tell you, working in the United States, we have to deal with insurance companies. And I'm going to be honest, we are not very good friends with them. We are not the best of buds. We don't see eye to eye on many things because so many of us feel that insurance companies put themselves in the middle of those healthcare decisions, and they make decisions more based upon their bottom line and their money. So, they collect the premiums and then they have to pay them out. And they don't want to pay out. That's really what it comes down to. They don't want to pay out for any of these services. And if you look at many of them, their profits keep going up every year, and they pay out less and less. And if you ever want to kind of see that, one of the biggest issues that people have about the APTA, number one thing that they'll say is lowering reimbursement rates. That insurance companies cut what they pay every single year. And really, if insurance companies could pay $1 for treatment, they probably would. They would pay as little as possible on that. In the ways that they save money, biggest one is they cut visits. One thing that we do with our patient when you're coming in and sitting across from us is that we make a decision about how long we believe that you, the patient, will get better. This is based upon, again, research that is out there, our own clinical judgment. We take a lot of the stuff that you tell us. We take that all into account to say, like, okay, if you have this condition, if we believe we do all of this, you're going to reach these goals in about this long. And we understand, yes, we want to reach that. But however, this company will come in and say, no. We know that you want 12 visits on that, but no, 4. That's all you're going to get. Now, again, people are going to come out and say like, oh yeah, you're just trying to milk those things and stuff like that. I got examples here of people with very serious disorders getting like no visits at all. So somebody here tell me that have a patient with a total knee arthroscopy, so a total knee replacement. 4 visits, the discharge to an independent home exercise program. That's not a whole lot. Let's see, 10 visits for a 14-year-old post-op ACL reconstruction and then denied any further authorization. That could be pretty detrimental because 14-year-old, what's going to happen when they're 18, 25, 30? If they don't get good care early on, they can have a lot of issues as they go along. Oh, here's another one. Patient with no arms or no legs had their wheelchair denied. That's another thing that they'll deny coverage for things like that. I have seen that with wheelchairs. I had many patients that would come in that needed an upgrade wheelchair because it was wearing out. And we had to jump through so many hoops to justify why this person needed that wheelchair. I've had people who could not walk more than 10 feet without becoming so shaky in their legs, completely out of breath, about to fall over, and they cannot get around. And to say like this person needs a wheelchair to get around and to still function, they're a high fall risk. And I will tell you, if somebody falls, extremely detrimental. Somebody says in here that they had somebody that was a high fall risk, and they said, no, that wasn't a consideration. Just make them independent in their home exercise program for discharge, just to send them on along. And even disorders, they don't often care about the actual disorder because of how these affect people. So here's somebody saying like, patient is a firefighter with a massive rotator cuff repair. That's a big thing. That's a very labor intensive job. That's a hard job. 3 visits. That's all they got. 3 visits. Another person in a skilled nursing facility had a 21-year-old person in a coma with a traumatic brain injury. Insurance wanted us to discharge after a week because they weren't coming out of the coma fast enough. Yep, not coming out of the coma fast enough. How are we going to speed up somebody coming out of a coma? And this is something that we do for so many of our patients. They said they spent hours writing up every little thing to justify to get more. So if you ever wonder why your therapist is often sitting over their computer and writing so much, is that insurance companies want so much justification for every single little thing that we do, and they want to look for any little thing to deny that care. And that's why so many of us are very frustrated with documentation, that we don't like documentation. Yes, we want to document what we do, but we have to put in just enough information to say that, like, okay, you are getting better, but you still have limitations, because if you're getting too better, they're going to cut it off. But if you're not getting better, they're going to cut it off saying it's not working. So we have to hit this little happy medium. Sometimes we have to talk to people, and sometimes we have to justify it. And that gets ridiculous on there. So again, like I mentioned, the person before saying, no, we just need 3 visits. That's all you're going to get. I know I've played phone tag with them back and forth, that you're calling them, trying to talk to somebody. They're calling you back. They'll call after hours and say, no, we called, we're going to deny because no one answered the phone. It's like, yeah, because you called us at 7:30 at night and there was nobody in the clinic at that time. And when we call you back, you don't answer the phone. We go through so much to try to do all of this. And to be honest, it's one reason that burns out many people in healthcare is the insurance companies. It's not often our patients that really burn us out, and people will say, if I could just treat people, if I could do this and just help people and did not have to deal with insurance companies, I wouldn't. And that's honestly why so many people don't take insurance. That's why clinics open up more and more saying, hey, I'll do cash pay. I'm not even going to deal with the insurance company. I'm not even going to allow them to put themselves in between us. It's just going to be me and you making that decision on best what is needed for you. And we'll reach a price of whatever that you want to pay, and we'll go from there. So that's what it is. And if you're a provider, share your story down below. You know, your things about the insurance company. I think this is something good that we're doing, is that we're sharing these stories, that we're sharing, again, from the public. I think it is so great that the public shares, those issues that they are dealing with their insurance companies. And I think it's great that providers, that we have to share the stories of what we've tried to do to help our patients and how insurance companies have gotten in the way of them. Now, how do I think it's going to change with that? I think maybe it may be a couple things. Again, sharing these stories, getting this out there. I do think part of it may be employers, since employers are, they bring in these insurance companies to provide health insurance for their employees. I think if the employers start saying, look, this is what you're going to cover for our employees, and if they don't, they're going to drop them. I think that would be a good thing, because some of these really big employers can have a lot of sway with insurance companies. I do believe that, because the insurance companies kind of get in there, kind of manipulate them a little bit, just saying, oh, we're going to save you money. But what they're doing, they're saving money by not paying out a lot. They're going to make them pay the employee or the client pay more money on their end to save the company money, and then the health insurance company just gets all this and doesn't pay out. But I think employers really coming out and telling these health insurance companies, no, this is what you're going to cover to our employees. So if you have an issue with your health insurance, talk to your HR people. Let them know what they do and don't cover. I also think it probably had to be part of the government stepping into it. Part of the government stepping in, saying, like, you need to cover these issues that you need to cover. So if you are in the public, talking to your representatives, give them a call. Let them know what you feel. Let them know. They do want to listen to you. They do want to know what you're going through, because you're a voter. You are the one who votes them in or doesn't vote for them. Let them know what you're feeling. Talk to them. Write them letters. Send them emails. Give them phone calls. Let them know what you're feeling about this. And of course, with your insurance as well, talk to your providers with it. Let them know your frustrations. Listen to, help us understand what you're going through, and we'll talk with you about how we can help you navigate that as best we can. Because unfortunately, like I said, we have to try to play within their rules and things like that to help you. And we are fighting it. We fight it. Our associations go up against these health insurance companies all the time. They're always battling. They're always going against them with that. And like I said, ultimately, at the end of the day, we are on the side of our patients. We want our patients to get better. We want everyone to get better as soon as possible. So thank you so much for taking time out of your day to tune into the video. If you liked it, hit that thumbs up button. Consider subscribing to the channel. It won't cost you a copay or anything like that. And like always, take care of yourself. Take care of your patients. See you next time.